Thomas Chest Pain Network is a collaboration of 18 hospitals and numerous emergency medical service agencies from 68 counties across Middle Tennessee and Southern Kentucky that work together to share best practices and improve health outcomes for medically underserved cardiac patients in rural populations.
My role in the Chest Pain Network is to help coordinate the medical protocols that we use. There are a lot of rural communities that are underserved with regards to cardiac and medical care. We have made significant strides in improving people's heart health.
Well, our Chest Pain Network here at St. Thomas, it's run by a group of nurses who basically coordinate the care we give for acute coronary syndromes, particularly heart attacks.
By leveraging clinical resources, educating rural providers and communities, and developing a unique acute coronary syndrome data registry, the Chest Pain Network addresses barriers to care faced by the rural and uninsured. In the last 2 years, over 15,000 patients from nearly 400 zip codes have been included in the data registry.
The St. Thomas Chest Pain Network began in late 2006, and we had this great idea that we would go out and work with rural facilities across Tennessee and Southern Kentucky and share some of our resources that we have here at St. Thomas. There is a hospital in every community that we serve. However, they have limited access to education, so the protocols aren't in place for the cardiac patient. Without us, there wouldn't be a data registry, so it'd be almost impossible to identify educational needs and the protocol need and the education for the physicians.
The mission is simple and the goal is shared. The smaller rural facilities work with larger urban centers to reduce avoidable delays in the triage, evaluation, treatment, and transport of suspected acute coronary syndrome patients, lowering rates of heart disease and cardiac-related death.
We're helping the patients by making sure that the care is streamlined, by providing education for the physicians in the rural communities where our families are as well, so we're all very passionate about helping the rural patients. We want them to have the same access to care as everyone else.
A lot of what we do is relationship building. We do that through education opportunities, just being there, working with them in the trenches, but then also being there on the other end of the line when they need us.